premiums under the new healthcare law, and that $8 billion, which was included in that amendment this morning, is not nearly enough to lower those costs. So I'm wondering, how does that, which would be a major premium hike on the sickest patients, square with the president's promise to both lower premiums and take care of those with pre-existing conditions?
So it sounds interesting to me that there are so many variables that are unknown that to make an analysis of that level of precision, it seems almost impossible. Hold on, let me give you an example. So right now, pre-existing conditions are covered in the bill. They've always have been. We've talked about that before. States have the right to receive a waiver. If someone has continuous coverage, that's never going to be an issue. Regardless of no circumstance, does anyone with continuous coverage would ever have a problem with pre-existing continuous. If someone chose not to have coverage for 63 days or more, and they were in a state that opted out, and they had a pre-existing condition, and they were put into a high-risk pool, then we've allocated an additional $8 billion over 5 years to help drive down those costs. So for someone to know how many people that is, what number of states are going to receive a waiver, ask for and receive a waiver, is literally impossible at this point. So to do an analysis of any level of factual basis would be literally not an impossible thing.
Follow-up questions.
Okay.
One, would the president prefer, does he have a preference as to whether or not states opt out, given that option? And two, yes or no, will people with pre-existing conditions pay higher premiums under this bill than they currently do?
I think everything that we've done, including the additional $8 billion this year, have everything that I've seen shows that the cost curve goes down for them in a lot of ways. So I would, if you have pre-existing conditions, and again, remember what a small pool that is. If you have a pre-existing condition currently, the bill protects you. The only factor would be is if you live in a state that potentially has asked for a waiver and then is subsequently granted it, and if you've gone 63 days without continuous coverage. So if you have continuous coverage, if you live in a state, it'll never ever be a factor. But the president has worked to make sure that in every single scenario, everybody, he has kept true to his word that pre-existing conditions are covered and that the cost curve continues to bend down. And so.
Then on that other question, the congressman this morning from Michigan was saying he's confident from conversations with his governor that his state will not ask for a waiver.
Great.
Does the president have a preference as to whether or not states ask for waivers?
The president's preference, and the president believes in states' rights, number one. Number two, his, not just preference, his goal is to make sure, as he stated repeatedly, is that pre-existing conditions are covered, care coverage goes up, and costs go down. Those are the principles that continue to guide him. Cecilia.
Thank you. I want to go back to Director Comey on the Hill today and some things he said about Russia. One of the things that he said was the Russian government is still involved in American politics. Is that the view of this White House?
I think that's the view of the FBI. I mean, I'm not.
Is that different than the White House?
Well, I don't. I mean, we rely on them and the rest of the intelligence community to provide the president with updates on what they're learning. So it's not. We don't. It doesn't go that way. The director and the intelligence community update the president on all of the threats that the United States faces. And all of the intelligence activity that need to be briefed.
And in that particular one, does then he accept that?
Well, again, I don't know what he has briefed the president. I'm not trying to be coy on this, but I'm just saying, like, I don't know what he has recently briefed or how. I know that the question that was asked during the testimony, I don't know what new evidence beyond what they shared with the president in December has happened between then and now.
Okay, there's one more thing on that front. He called Russia, quote, the greatest threat of any nation on earth. Is that something the president agrees with?
I think the president's been very clear that he thinks the threat that North Korea poses with the potential nuclear weapon that has range capacity is something that he finds to be threatening to the lives of American and our allies.
In January, the president did an interview deriding the little toy walls on the southern border. That's a quote, and said, "I don't know why they're even wasting their time." Why is the government's focus so much on existing border security measures rather than fighting for the wall that he promised that he would build?
Thank you for an opportunity to show you some things. So if I can get the first image up. You asked. No. But you literally could not have helped me out. This is what exists right now throughout our country. This is the kind of barrier that exists throughout the country. You see a place where cars can literally create little things and drive over. You've got places that can get burrowed under. That one they've cut through. That one doesn't seem to be too effective at keeping people in it. This is what those images represent our nation's current border security. According to a GA report from earlier this year, from fiscal year 2010 to fiscal year 2015, the Customs and Border Patrol recorded a total of 9,287 breaches in pedestrian fencing at an average cost of $784 per breach to repair, right? So every time that they cut through, break through, put something over, it's costing just under $1,000 for us to go out and have to fix. Now to the next slide. You had no idea you were getting this, did you? So the bill that is about to get passed, Title VI, which pertains to the Department of Homeland Security's funding on additional appropriation, states that an additional $497.4 million, quote, for procurement, construction, and improvements. Of that total, $341.2 million are to, quote, and this is literally what it says in the bill, to replace approximately 40 miles of existing primary pedestrian and vehicle border fencing along the southwest border using previously deployed and operationally effective designs such as currently deployed steel bollard designs that prioritize agent safety. So that's your answer, Charlie. Hold on. So hold on. Let me just, we have a porous border right now with broken fences, things that can be cut through, places that can just literally be driven over. And to replace this with 20-foot-high Ballard wall will protect our country, something that the DHS has designated the most effective way to do this. So that's what we got out of this bill.
Just one question about
Sure.
the photos. Are those photos of fences or walls?
That is called a Ballard wall. That is called a levee wall.
So that's the wall that
No. There are various types of walls that can be built. Under the legislation that was just passed, it allows us to do that. As we've mentioned, that is called a levee wall on the left. That is called a Ballard wall. Huh?
So that's not a wall, it's a levee wall?
That's what it's actually called. That's the name of it. It is called for...
Building fencing, not wall.
In this current bill, it allows us to do the following. So to be clear, in several areas along our southern border, we have what was in the first slide, which are areas in which someone can literally cut through with a pair of wire cutters or put a little barrier over that a car can drive over the top. Okay, what we've done is taken the tools that we have to replace, and if you look at that one in particular, you've got a chain link fence is what is currently at our southern border. That is literally down there now. We are able to go in there and instead of having a chain link fence, replace it with that Ballard wall. That's what it is.
But it's not the wall the president promised.
Hold on.
It's not the wall.
Hold on, Jim. We're going to take turns, but just to be clear, because Charlie has the same thing, so I'll give you a little help on this one. That this is the 2017 budget. The president. This is a down payment on what the president is going to prioritize in the 2018 budget that starts October 1st. And as I mentioned to John Roberts, the idea that we even got a shot at this is something that should have been done last term under President Obama. We have an opportunity to use the last 5 months of the FY17 budget to get the president's priorities jump-started. So he is using the current bill to get his priorities moving and put it down. To answer the question, it is currently being built in Naco, Arizona, Sunland Park, New Mexico, and we are going to be starting to do this in San Diego, El Paso, and Rio Grande Valley.
Basically just telling supporters, the president's supporters, to be satisfied with this existing tough guy fencing until he's ready to build the wall.
No, what I'm telling anybody is that the president said he was going to build a wall, and he's doing it. He's using the best technology and what the Department of Homeland Security under Secretary John Kelly says is the most effective way to keep people out, to stop drugs, to stop cartels, to stop human trafficking, and to prevent illegal immigration. That's what I'm telling you.
Today and said he wants to see East Jerusalem as the capital of a future Palestinian state. Yesterday, Vice President Pence said you're still looking at moving the U.S. Embassy in Israel to Jerusalem. What is the White House view on those remarks? I mean, we didn't hear anything from President Trump in response to that.
I think the Vice President, as you noted, commented yesterday that it's still something that is being discussed and considered by the President. It'll continue to be a discussion that he has with both Prime Minister Netanyahu and President Abbas, but obviously we're not
On
going
the
to.
Palestinian portion of that.
Again, I'm not going to. I will. They had a series of private discussions. That is why the president is able to effectively get things done for this country, is to not negotiate out in public. He's going to continue to have discussions with Prime Minister Netanyahu, President Abbas, moving forward, and he feels confident about where that relationship was and developments that were made today.
He
Jim.
doesn't object to what
It's
President
not-
Abbas said, it's just not decided.
It's
Is that
not,
what
no,
you're-
it's not a question of not decided. I'm not going to negotiate what they are talking about in private from this podium. So that's,
That's why I'm
I
asking.
understand it. I'm just telling you that we are not going to negotiate from the podium. Jim.
Just to follow up on the president's meeting with Abbas, he did say at one point, frankly, talking about Middle East peace and the Israeli-Palestinian conflict, maybe it's not as difficult as people have thought. Why does he believe that the toughest, arguably the toughest foreign policy challenge in our lifetime may not be as difficult as people have thought?
I think both of these leaders have very publicly expressed the confidence they have in the president's negotiating skills, in the president's desire to work to get peace, the relationship that he's built with them individually, and the trust and respect that they have for him. And I think that he, in discussions with them, in private discussions with them, feels very optimistic about the shared goal that everybody has. Obviously, there's a lot of issues that have to get covered, but the president understands that they respect his ability to want to get this done, his relationships and respect that have been developed, and I think this is something that he really wants to have happen.
And getting back to healthcare, why even monkey around with pre-existing conditions? That's the most popular thing in Obamacare. Why are you guys spinning your wheels, messing around with pre-existing conditions?
I wouldn't call it messing around, or however you phrased it. I think the president wants to do everything.
Right now, people with pre-existing conditions are covered. They're not discriminated against.
No, just hold on.
You're going
just
to change to a system where who the hell knows what's going to happen? It depends on what state they live in. If they live in this state over here, that governor may seek a waiver, and all of a sudden they're thrown into this system where hopefully that fund is going to cover their pre-existing conditions. It is a big change for people who live with those kinds of illnesses, is it not?
Well, look, the big change, I guess we have a very different view of this, because my view, and I think the president's view, is that Obamacare, if you have a pre-existing condition and you no longer have a health care provider, and your premiums or deductible are going through the roof, then you don't have coverage. And we just read it out. I mean, if you have
throwing the baby out with the bathwater.
No, what I'm saying to you right now,
Obamacare, because it's not,
It's
you're
not a
saying it's
question
not
of-
working, but then why change pre-existing conditions?
We're
Why?
not. No, we're
Why change that?
strengthening. I think, look, we have done everything to not only strengthen, but to guarantee.
Strengthening it if the
Absolutely.
governor can say, here's my waiver and no more
Sure you
pre-existing
can, Jim. I
conditions.
walked through this. But I think the fundamental point that seems to be getting lost is that if you have Obamacare right now, in case after case, you are losing it. So if you have a pre-existing condition and you have a card that says Obamacare, but no one will see you or you can't afford it, then you don't have coverage.
Why not
The-
fix that?
We are.
Fix that
We're
aspect of
guarantee
it.
it, but I don't know how much.
Why does
we
the
have
pre-existing
literally
condition component have to be altered? Why not just keep that
The
protection
president
in
has made it
place?
very clear that pre-existing conditions are covered in the bill under every scenario. I don't know how much clearer we can state it.
So
That-
anybody who has a pre-existing condition under Trump care, they're going to be fine.
Yes.
Without question.
There you go.
Thank you, Sean. Thank you, Sean. Want to follow up on healthcare. I just want to know why the White House is pushing so hard for a vote on this healthcare bill at a time when, as you just said a few minutes ago, it's literally impossible to analyze its impact on the healthcare system. Why not wait for that analysis to come out?
The vote is going to happen, as I've said like 8 times now, when the Speaker and the Majority Leader and the Majority Whip want to. Our job is to work as hard as we can to work with members of Congress who want